Hello and welcome to Talk to Your Health. I'm your host, Dr. Derrick DeSilva. April is Women's Eye Health and Safety Month. And here's something you may not know. 2/3 of blindness and visual impairment occurs in women. Here to talk about that and what women need to know to protect their vision is Dr. Lior Koppel, an American Optometric Association physician with practices in Edison and South Plainfield. Welcome back to the show.
Hi, thank you very much. I appreciate that.
So why women? I had no idea that that was the case.
Yes, it's interesting. It actually is two big reasons, longevity and hormonal changes. Women tend to live longer than men. As a result, we diagnose more diseases with them, and also hormonal changes, pregnancy and pre- and postmenopausal.
So the hormones, that's another thing I didn't know. Hormonal changes, the menopausal and perimenopausal women can also have these issues?
Yeah, a lot of them can develop a lot of dry eye syndrome problems, a lot of issues with that. It's very big, yes.
What are the more common conditions in the United States that contribute to loss of vision, blindness?
There's 5 big ones. It would be dry eye, macular degeneration, cataracts, glaucoma, and diabetic retinopathy.
Heredity? Does heredity play any role with regard to visual loss?
Yeah, huge, especially in macular degeneration. It's a disease that affects the central portion of the retina. It could be very devastating. Unlike glaucoma, which affects periphery first, you don't really notice it until it's too late. In macular degeneration, it's just the opposite. So it's a lifestyle change. It's life-altering, not being able to see your kids, not being able to read.
Mm-hmm. Risk factors. What are some of the more common risk factors? Because, you know, there's one thing that we want to get clear, loss of vision and blindness. We'll talk about that in a little bit. But what about the risk factors that we have here?
Okay. Well, some of the big ones are going to be smoking, excess weight, unhealthy foods, lack of exercises, and exposure to ultraviolet radiation. So let's say, for example, that you're a blonde-haired, blue-eyed female who maybe smokes, doesn't exercise much, and you happen to have a parent who has macular degeneration. Unfortunately, you go to the head of the class as far as risk factors for macular degeneration.
Do we know why with macular degeneration there's a hereditary link? Has that been identified?
It's funny you should say that, actually have come out recently with a genetic testing called macular risk genetic testing, which can actually find risks and categorize it and give us more information as to how often we should see someone and how to treat them as well. Mm-hmm. We didn't have this before, but we do know that smoking is huge in this, and so that's why you really should stop smoking. It is a contributory cause for cataracts as well as macular degeneration.
Well, I've said this many times on this show, smoking contributes to 22 different types of cancers, all right? So, you know, smoking is probably not a real good thing to do, and I think people really need to stop that and they need to understand that. Is any of this preventable? I mean, as far as diabetic retinopathy, control your sugar. What about some of the others?
Sure. Best thing you could do out there is eat healthy foods. I'm looking at these foods across the table. Green leafy vegetables, spinach, kale, yellow foods, egg yolks, mangoes. All these foods are so rich in dietary things, what we call like lutein and zeaxanthin. These chemicals, they sound fancy, but you know what? If you think about it, if we don't have enough of these foods, then we take supplements. And now there's supplements that can boost it, or like an octane boost. Mm-hmm. People and women that have osteoporosis, we tell them to take vitamin D supplements and calcium. Sure. Well, now we have supplements for macular degeneration and overall good well-being. Omega-3 fish oil, it's great for dry eye problems too. So these are good, all healthy things we can do.
I love, you know, you're my new favorite optometrist because of what you just said. Lutein, zeaxanthin, a good mix of tocopherols and tocotrienols and vitamin E, fish oils, all of those things. The big thing that people come to me with is my dry eyes. What can I do for dry eyes? You said fish oil. What else?
Yes, exactly. Well, usually...
And why do people get dry eyes, by the way?
Well, again, women, hormonal changes. You're going to have less tears, or good quality tears, and also possibly more evaporation that's going to occur. So usually we would start them maybe with some lubrication therapy. There's other anti-inflammatory medicines that we can do to try to control this.
Eye exams, how often should people be getting them?
Infants between ages 6 months to 1 year should have their first eye exam, then again at age 3, and then again before starting school. Adults should have an eye exam annually. You should go out there, go visit your optometrist, get an annual eye health exam. It's very important.
And I think this is, and when you said, what did you say, infants?
Infants, yes. 6 months of age to 1 year should have their first eye exam. Yes.
Wow.
Yeah.
And then people, as they get older, over the age of 50 or over the age of 40 every year?
Over the age of 40, and as directed by their eye doctor. Again, because of these different eye health conditions, they may need to be seen more often. Absolutely.
Thank you for joining us.
Thank you very much.
Pleasure to have you here again.
I appreciate that.